University of St. Francis. Today I'm going to be demonstrating a newborn assessment. The first step is I'm going to be washing my hands for 3 minutes before touching baby. My next step is I'm going to check the baby's ID band, and I'm just going to verify that I have the right baby. Once I do, then I'm going to don my gloves to begin vital signs. The first vital sign I'm going to be taking is the baby's temperature. So I'm going to stick it underneath her auxiliary, his auxiliary, it's a boy. I'm also going to put my hands on his abdomen just to keep baby warm. You always want to keep baby warm during assessment. It'll help the baby not be aroused as much. So as my hand's on the abdomen, I'm just going to be feeling for a baby's respirations. The normal range for respirations is 30 to 60, and the normal temp is 97.7 to 99. Next, I'm going to be listening to baby's breath sounds, and I'm going to do this by listening to the apex above the nipple line on both sides. For baby is 30 to 60. I'm also going to listen to the base of lungs on the side of the baby, above the envelope or the belly button, just on the side over here. And then I'm going to listen to the baby's apical pulse. The heart rate for the baby should be around 100 to 160. And after I'm done taking baby's vital signs, I am going to take off my gloves. And I'm going to start with the baby's head. So I'm going to take off baby's cap, and I'm just going to be assessing the baby's head. I'm going to be looking for bruising, any scrapes, looking for the collar, and then I'm going to start to gently palpate baby's head. First, I'm going to be looking for molding. Molding is a normal finding, normally when the baby's head forms to fit out the birth canal, so sometimes it can be cone-shaped, which we would document this, even though it is a normal finding. Next, I'm going to look at the fontanelles. So I am going to look at the anterior. Anterior should be larger than posterior, and it should be a diamond shape. So I'm going to feel for that, and then I'm going to feel for the posterior fontanelle. This is going to be more smaller and triangle shape. I'm just looking for indentations, any abnormal findings. Next, I'm going to look at the suture lines. So suture lines, we're just making sure there's no gaps, just that they're straight lines. Just make sure there's no abnormal findings. Next, I'm going to be looking for caput succedaneum, which this is, it can cross over baby suture lines. This would be an abnormal finding. It would be just swelling of baby's head. And also, I am going to be looking for cephal hematoma. This is going to be found on just one side of baby's suture line. So just be on one side of the head. This baby has no abnormal findings on the head, so I'm going to put baby's cap back on to keep baby warm. Okay. My next assessment of the baby is going to be their eyes. So I'm just going to make sure they're symmetrical, and you can do this by doing the 1/3 method. So make sure each baby's eyes and nose and other eye is all 1/3 and in a straight line. So I'm also going to be looking at baby's eyelids, epicanthal right here, which would be an abnormal finding. It's just over the extra eyelid. I'm going to be looking for subjectival hemorrhages, any discharge on baby's eyes, and everything looks great on this baby's eyes. Next, I'm going to go to the ears. So I'm just also going to look at the position of the ears. Baby's ears seem to be midline, so the inner canthus of the ear and the outer canthus of the eye. Use my finger, kind of just make a line there. I'm also going to be looking at the recoil of the cartilage of the ear. So by doing this, we're going to fold the ear down right here, and then I'm going to let go, and if the baby's ear goes up, then that just shows maturity. If baby ear stays down, then that's going to be a sign for prematurity. So there's no discharge in the ears look good. Next, I'm going to move to the nose. So I'm going to look for the patency because it's very important that babies can breathe through their noses, especially when they're breastfeeding or drinking out of the bottle, just so they're continuing to breathe. So by doing this, I'm going to cover up one nostril, make sure baby's breathing out the other one. Okay, patency of the nose is good. Just check for discharge of the nose. Just make sure that everything's normal. I'm also going to look at the skin of the face. I'm going to look for like stork sign. I'm going to look for milia, which can be found on the nose. It's like white pimples, which is completely normal for babies to have, but you will need to document it. Next, I'm going to don my gloves because I'm going to assess baby's mouth. So I'm just kind of going to put my finger above the baby's mouth, check for rooting. The baby normally will open its mouth, so my finger will go in baby's mouth, and I'll just be checking the palate of the baby, making sure that it's smooth and that there's no gaps, that it's straight. I'm also going to be checking for the sucking sensation of the baby, and this baby has a good suck reflex, and palate is normal. And then I will take off my gloves to continue. Okay, next we are going to be checking baby's neck. So I'm just going to use 2 fingers and I'm going to gently palpate baby's neck. I'm going to be looking for masses, just any indentations that are abnormal. Next, I'm going to check baby's neck's range of motion. So we do this by turning baby's head side to side. And baby has great range of motion. Next, I'm going to check baby's clavicles. So I'm just going to lightly palpate them. I'm just checking to make sure baby's clavicles aren't broken or if there's any swelling of baby's clavicles, because normally in larger babies going through the birth canal, clavicles do break. Great. Okay. Now I'm going to gently undress baby. Try not to arouse him too much. Okay. I'm just going to be looking for baby's stomach, like the collar of the baby. I'm going to be looking for any peeling, any limnogo, any vernix, just any birthmarks, rashes. Just make sure baby's skin is good. And this baby's skin is pretty good. I'm also going to be checking for jaundice. So the 5 ways to check for jaundice is to blanch the forehead, make sure that there's no discoloration. Also check the eyes. The sclera should be white, shouldn't be yellowish. And then you're going to blanch the chest, blanch the stomach, or the abdomen, and then also blanch the inner thigh. That's how you check for jaundice. This baby is clear jaundice. Next, I'm going to check for respiratory distress. So the 5 ways that you can check for this are baby's nose will be flaring, so make sure their nose isn't flaring. You're also going to see a seesaw motion in between the chest and the stomach. You're going to also see retraction of the baby, which is when the baby breathes really hard and there's indentations in her ribs, his ribs. And then you're also going to do apnea. So apnea for babies, they'll just stop breathing for 20 seconds, so you just want to watch for that and make sure baby isn't doing that. Okay, and then after we check for respiratory distress, I'm going to check the umbilical cord. So I'm just going to look at baby's cord and make sure there's no discharge, there's no redness, and make sure, check the dryness of it or if it's moist. And this baby, the umbilical cord is drying up, which is a good sign. And then, yeah, so I'm going to check for that. And then next, I'm going to move down to baby's genitalia. So before that, I'm going to don my gloves. I'm going to pull baby's diaper back. And while I'm doing this, I can check if there's been any voiding or if the baby's pooped at all. And if so, then I would absolutely change the diaper before continuing. So during this, since it is a male, if they have had, I'm just going to first palpate their testes. to check for any masses, to make sure their testes have distended. I'm also going to check the meatus, which is located normally at the tip. If the baby isn't circumcised, then I'm going to pull the tip back and just make sure the meatus is in the right location. I'm also going to check and see if the baby's discharged at all. Just look for any abnormal findings. So this baby looks great. Okay, so then I would take off my gloves. And I'm going to check for the baby's muscle tone. So to do this, if it was a real baby, I'll just demonstrate on myself. What I'm going to do is I'm going to pull the arm back and recoil it for 3 seconds. And then after I hold it for 3 seconds, I'm going to put it down and let go, and then the baby should recoil its body back up. And if it does that, then it has great recoiling, and they'll also make a C when they do that as well. So I'm also going to put the baby back up, and just always keep baby warm. I'm going to next look at their hands for palmar creases. So this baby, it has 2 indentations of 2 creases on both hands. Yep. And a sign that we normally see for Down syndrome is that they just have 1 crease across their hands. So we're always being aware of that and yeah. And then we're also going to look for digits and make sure they have 10 digits. So this baby has 10 digits. Next, we're going to go down to the feet, and I'm going to look for palmar creases on the feet. So if baby has a lot of lines on the palmar, then that means it's a sign for maturity, which is what we want. But if they don't have as many lines, they may be premature, which is still a normal finding. It's just something that occurs. So again, I'm going to look, and I'm also going to check the toes and the digits for both feet and both palmar creases. And then also a assessment we do down here is called Babinski's. And what we're going to do is we're going to take your finger or even like a pencil and use the head of the eraser, and we're going to draw a backwards J. And then as we're doing this, baby's toes should flare up, and this would be a normal sign. And we do that on both feet. And then again, the baby's toes should flare. Okay. My last assessment for baby is called the Moro. And so you need to have the blankets off baby to see its reaction. So you can either clap or slap the bed, and the baby should react to it. So, okay, and then the baby would react to it if it was positive. So baby's emotional state. During my assessment, the baby was alert and awake. And before I came in, I would check when baby's last voided, when baby's last went to the bathroom. I would just check the emotional state of the baby to have my findings. Baby looks great, and thank you for watching.